Surviving breast cancer can lead to other concerns for patients. Many women may worry whether the treatment they'll need to fight the disease will affect their ability to have children.
Advanced treatments are helping more women diagnosed with breast cancer survive. Many of those women are under the age of 40 and may be planning to have children. But the treatments for breast cancer can make it difficult, if not impossible, for some of those women to conceive.
Basically, the cancer treatment involves surgery, chemotherapy, and radiation. And the dangers posed by those treatments, especially chemotherapy, are that they're going to lead to loss of the oocytes or eggs that will be able to be fertilized later on.
Both chemotherapy and radiation therapy can also lead to premature ovarian failure. That is, women's ovaries can stop working before the age of 40. Studies show the loss of fertility can lead to a lower quality of life for cancer survivors. But traditionally, the main concern for cancer patients has been survival.
Questions such as, am I going to be alive? Am I going to beat this cancer? And then fertility preservation has been kind of left to the back burner, so to speak.
Results from a recent study, POEMS, the Prevention of Early Menopause Study, tested a way to help women with one type of breast cancer, hormone receptor negative breast cancer, maintain their ability to have children while still getting necessary cancer treatment.
They were randomized to either receive a hormonal shot called goserelin, starting a week before the first cycle of chemotherapy versus placebo.
During the study, one group of women got the drug once a month during their chemotherapy.
There was a dramatic difference in ability for patients to retain their ovarian function and also later on to conceive in the study group.
Only 8% of the women receiving the test drug and chemotherapy had ovarian failure, compared to 21% of women who had chemo alone. And 22% of women getting the drug were able to get pregnant, twice the percentage of women on chemo only.
Compared to other fertility preservation, this was a very simple intervention. Patient would get one shot that could be even started maybe a couple of weeks before chemotherapy if one has enough time.
Research is going on to see if the medication will help women with other types of breast cancer. Doctors believe the therapy will be simpler than the standard approach to preserving fertility in young female cancer patients, which usually requires women to harvest and store ovarian tissue, follicles, or embryos prior to cancer treatment. For Smart Medicine, I'm Doug Johnson.